Good morning, everyone. Welcome to the next webinar of our first webinar series on lifestyle medicine, which is presented to you all by Association of Physiologists of Rajasthan, which is the state chapter of SOPI. So, today we are going to talk about the science and practice of exercise in the lifestyle medicine. For that, we have with us Dr. Om Lata Bhagat. She is the professor in the Department of Physiology at All India Institute of Medical Sciences, Jodhpur, Rajasthan. Uh, so she holds an MBBS degree with a master's in community health and MD in physiology. She has also earned certificates in the field of yoga therapy, intellectual property rights, machine and deep learning, and biostatics data analytics. Research spans and her experience in research spans across cardiorespiratory physiology, wellness practice, and medical technologies with involvement in patient care with autonomic function testing. She has more than 30 publications in her credit. So let us learn more from Dr. Om Lata Bhagat and share her experience in the exercise physiology, which is a very strong pillar in the lifestyle medicine.
Thank you,
Welcome,
ma'am.
madam.
Thank you, ma'am. Thank you for giving me the opportunity to speak on the exercise as practice in the lifestyle medicine. Let me share my presentation. Can you see my screen? Is my screen visible?
Not yet. Please share your screen.
I have shared it. It says yours. Okay, stop sharing. I just. I'll try to share the whole screen.
Yes,
Then,
please.
yeah. Is it visible now?
No, it is not.
Ma'am, it is saying you are sharing your entire screen and then why it's not visible?
Should I share the PPT which you have already shared with us?
Ma'am, then it won't be.
Okay, there it goes. Your screen is on stage.
Okay. So, good morning, everyone. Uh, I am Dr. Omlata Bhagat. You all know that. And thanks, ma'am, for my introduction. And we are here to talk a little about science and practice of exercise, as in the lifestyle medicine. So, what is lifestyle? When we talk of lifestyle, we talk of a certain way of life where which could be a not just yours. It could be having a different aspects of the society, culture, your family, your opinions, your values, and many other things. But as we put it, a term lifestyle on the web search or somewhere in our day to day vocabulary, we usually talk of, which is the luxury, right? The brand lifestyle. But it's not that. And if we talk of little more, then people talk of you have a sedentary lifestyle, you're a couch potato. People do have healthy or active lifestyle, but there is something which is very important, that is my lifestyle. Everyone has their own way of living, and therefore when we talk of lifestyle, it is a very personal to everyone, yet generalizable. So life always gives us options, but with no choices. So you have some situation like that. Everything looks same, but you don't know where to. Then we can usually go that my way or highway. Then also we can, even if we choose, we have to carry our own burdens. So that's a problem. But now we are putting medicine to this lifestyle. So now we are involving another person who is not same as we are. So this patient comes, therefore the perspective of someone others is important, because you are dealing with his lifestyle or her lifestyle, the way they lead, and we have responsibility to influence that lifestyle, right? Why this lifestyle medicine comes in picture? Because we have a rise on lifestyle diseases. If these diseases are called lifestyle, then if you change lifestyle, these diseases will also disappear or maybe get benefited to it. So very simple notation we have all seen, like if you eat more, less active, you can have obesity, thereby you can get lifestyle diseases. But it is not that simple. There are so many things which are happening which are not avoidable, like pollution, like inheritance, infections which are there in the environment you cannot do. So our modern lifestyle plays a crucial role in ecology. Therefore, we need lifestyle medicine to be the part of our strategies to tackle the health threats. And lifestyle medicine addresses root causes of the diseases rather than just symptoms, reduces healthcare costs by preventing diseases, and improve quality of life and longevity. So we are trying to add life to years in a person's life. But what has changed over the years is, this picture depicts us very clearly. We have stopped working manually, and our job profiles are changed to an extent that we are bound to be sedentary. So, therefore, there is a need of science and practice of exercise in lifestyle medicine, because that's how we can have impact. When you talk of exercise, you can think of something very boring, very tiring. I will not do it again. But it could be running, running towards your health, running for your health, and running away from the boredom. Let's do some dance, enjoy the moment, and dance like no one is seeing you, so that you can move your body, and thereby you can add some non-exercise energy expenditure to your daily routine. Or you can actually go for some light and heavy exercises, moderate intensity to heavy intensity, or you can go for some calming practices like yoga, pilates, which can take you to the highest level of relaxation along with the exertion. So, when you talk of exercise, what is exercise? It's a physical, and there's terms which we often use interchangeably is physical activity, exercise, and sports. So, physical activity is any movement that requires expenditure of energy. Any movement. Exercise is structured and repeated measures that deliberate intent to improve or maintain the physical fitness, and sports is competing nature and its organization. So, physical activity includes exercise and sports, but not all exercises can account to sports, and not all sports can account to complete exercise. But yes, to play a sport, you need to go for exercises very meticulously. So, what is it? What is physical fitness? That is one another concept which is very important. So, physical fitness can be divided into health related physical fitness and skill related physical fitness. Cardiorespiratory endurance, body composition, muscle strength, muscle endurance, and flexibility, which is health related physical fitness. We do have agility, coordination, balance, power, reaction time, speed, which is skill related physical fitness. These are more important for the competitive uh, sports, whereas we as lifestyle medicine concerned people, we are more bothered about health related physical fitness. And your lifestyle is a continuum of sedentary and active lifestyle. If you put it across the physical active or physically or sedentary lifestyle, you can have people who can be physically inactive and highly sedentary, and also you can have people who are physically active yet sedentary. So therefore, it is a continuum, and we must understand this continuum as a part of our total 24-hour movement of non-movement and movement behavior based on the met values which we use. Therefore, the concept of non-exercising thermogenesis is very important, because that energy expenditure is very, very important, right? So, what is exercise? It's a normal physiological state which usually disrupt your homeostasis, and it encompasses all activities that are planned, scheduled, and structured with given repetitions for the purpose of improving physical fitness. That can include any kind of exercise, maybe it's yoga, Pilates, fit, hit, anything, right? So, what are the principles? First principle is your homeostasis, and we all know the body has a capacity to make everything fall in a very narrow range. But your exercise is a commonest and strongest disruptor of homeostasis. It gives you perturbations that helps you make the system better, because your homeostasis is being challenged and the body is trying to reverse the change and trying to make more balance. In turn, there are reactions, and your whole body, your central nervous system, metabolism, skin, oxygen transport, skeletal muscle, everything go into change, by immediate response and therefore by adaptation. So homeostasis is the first and foremost important thing. How it get effect is something which we all know as a physiologist, that cardiac output changes. But we must understand that cardiac output changes to an extent, and the redistribution comes into picture. And you can see that even after redistribution, the the amount which is required on for other activities apart from muscle and heart does not change much, right? So even if body changes, reacts to an extent, but still somewhere homeostasis of the local level remains. So the second thing is your overload. So it is always good to have something which makes you uncomfortable, that adds to your ability more and more. And it's a progressive overloading. You cannot overload yourself to an extent that you can damage yourself, but yes, a micro damages and giving them time to heal makes you stronger. It is a common saying which what does not kills you makes you stronger. That's how vaccine works, right? Then specificity. You must understand that not only one single activity can help you gain everything. It's like which uh, exercise you are doing, what area, what muscle group you are putting it, you are getting better and better in that. So therefore, you have to have protocols for the patients in which almost all the muscle groups should be involved, right? Otherwise, a person who has a very bulky figure may not have a good cardiovascular fitness, right? Then the other thing comes is reversibility. We all have gone mad about the Hrithik Roshan's six pack ab, but even he, being so active person, when he has not used it, he has loosened it. And so reversibility is a principle we must take it into consideration and make it clear that you have to have a maintenance dose of whatever you have done. Otherwise, it takes one third of the time to get it back to the original position, the time you have invested gaining your uh, body or the strength, cardiovascular strength. Last but not the least is the individuality. Every person responds differently based on initial fitness level, health status, and genetic makeup. So you should not give a challenge which is similar in condition to all the people. You have to have a custom made challenges given to the person so that they can improve, right? So what are the types of exercises which we usually do? So there are so many classifications comes into picture when you talk of type of class exercises. By muscle contraction, you can say that there's a dynamic and static and isokinetic kind of exercises. Isotonic exercises, muscle length changes during contraction involving joint movement, which can be either concentric or eccentric. Isometric is muscle contraction without a change in muscle length or joint movement, and isokinetic are the performed with constant speed of movement. usually do not make much focus on isokinetic. We do focus on isometric and isotonic, and we know that it changes, and the responses are varying if you are doing isotonic or isometric exercise. And remember that there's nothing very specific, or not all. It is very difficult to classify this, because there's some amount of both in the, so you can say that predominantly isometric or predominantly isotonic exercises, right? Then you have primary energy utilization, and thereby we can convert them into anaerobic and aerobic. Aerobic is that relies on the use of oxygen to generate energy, that is oxidative phosphorylation in mitochondria. And anaerobic, where you use the glycogen lactate system to generate the ATPs. And we, as a physiologist, we all have undergone these uh, things. In biochemistry, we must have mugged up about the lactate, pyruvate cycle, citric acid cycle, and all these. But we must understand that there is a temporal relationship of these energy utilization and the turnover time. Therefore, we have seen that we should not go for an exercise amounting less than 5 minutes. Why? Because otherwise you are not going to consume your fat or going for oxidative pathway, because it starts after 120 seconds. So if you are not going beyond 5 minutes, it's not worth it. And to therefore, and it's actually, if you can see that if mitochondrial fat is start consuming, when then the recovery time or turnover rate is best, and that occurs around 15 to 20 minutes. Therefore, all our recommendations gives us the minimum of 20 minutes exercise session, right? Then we talk of the exercises, like on the basis of intensity and duration of exercise. Low intensity exercise which is less than 30 minutes, moderate intensity for 3 to 6 minutes, and high intensity more than 6 minutes. So based on the intensity of how we assess the intensity, based on how much percentage of HR max we are reaching, or how many, what is our received perceived exertion. So that rate at which we are doing it can give us the idea of what is the, and the easiest thing which people have done it as, like, talk and sing test. If you are able to sing while you are performing, you are doing a low intensity. If you can talk but not sing, you are doing moderate intensities. And if you are doing high intensity, you are unable to speak few words, not more than that. And also, you should understand that rest is also important. Therefore, duration is also important, because you have the post exercise energy consumption, and there it takes rapid phase and slow phase, and it takes days to recover sometimes. So, therefore, rest is also important part of the any exercise regime. The purpose of training is strength training, endurance training, flexibility, or balance and coordination. You all know what they mean, but for the practical purposes, we usually talk about resistance and endurance training, and We all know that weightlifting, pushing, pulling, these are the strength training, whereas walking, cycling, running, swimming is aerobic. You have various components. Immediately, your responses are different, which we have talked a little, but it's not just immediate response. With training, your resistance training gives you muscle hypertrophy, whereas your aerobic exercises or endurance training gives you mitochondrial biogenesis. So, for any given purposes, if you want to make a planned regime for a exercise, you must include both, because you need both the muscle as well as the mitochondria. So, what are the effects of endurance training? And we all know that we assess the exercise or functional capacity by cardiopulmonary exercise testing. And the physiological effects of endurance training, like increased maximal oxygen consumption, can be assessed by increased peak VO2. Increased carbon dioxide production can be assessed by whether there is increased peak VCO2, peak VE, or reduced breath rate, breathing reserve. Increased lactate threshold, increased aerobic threshold will be assessed. Faster VO2 kinetics can give you the faster recovery in the CPET parameters, and likewise you can assess the greater extraction of oxygen by the changes in the ratios on the. We must understand, in health there's no or little effect on the peak heart rate, but other things does change, right? And when we talk of endurance versus resistance training, we must understand this is not completely independent in practice. Usually, they should be prescribed together. In rehab setting, gains may be attained in endurance as a result of strength, or as a strength because person will get strength because of the endurance training. We can have major changes in cardiovascular remodeling, skeletal muscle adaptation, and whole body adaptations. Uh, in resistance, you can get a concentric change, whereas in endurance, you can say change in the diameter. But if you mix combination, you can have benefits of both. Likewise, you have the muscle fiber hypertrophy, whereas you have the submaximal energy exhaustion efficiency and improved oxygen extraction at the muscle level. So, therefore, the combination is always good. With if we go for the disease conditions and the muscle glucose homeostasis, cognitive functions, and all, so you can see that the combined effect has a uh, better adaptation towards the better glucose homeostasis, improved cognitive functions, improved body composition, and improved mobility and flexibility, as well as the serum lipid levels. Though there are important areas which are affected by the endurance as well resistance training. So therefore, whenever you are planning exercise regime, you should be taking care of what is being needed. So it comes to the exercise prescription. We talk of modality, duration, intensity, frequency. So prescription usually contains some combination of endurance and strength training. And conventionally, we use jogging, cycling, stair climbing, etc. And for strength, weights, band body weights. For intensity, most effective at the 50 to 100% of peak HR or an improved rate of perceived exertion. Duration should not be more than 60 minutes at one go and less than 20 minutes or 30 minutes. And person should do it more than 3 days a week. Whereas for strength, we should look for the intensity, which is like how many repetitions person can make. And one should always go for the alternate days for each muscle group. And please give adequate amount to recover. So to make it easier, people has come up with to be fit, go for a fit guidelines. F for frequency, I for intensity, T for time, and the another T is for type. So how often you are going to do a exercise, how hard you are doing it, how long your session lasting, and what form of exercises you are performing. And you must involve all these components to formulate an effective yet realistic physical activity program whenever required. What are the recommendations for frequency? They said for cardiovascular endurance, 3 to 5 times per week. Strength training, 2 to 3 days per week. Intensity, cardiovascular exercise, you have to have reach to your 65 to 85% of maximum achievable heart rate. For strength training, you should go for 8 to 15 repetitions per set and do not go beyond 3 sets. If you are going beyond 3 sets, it's good, but then repetition should be less. Do not overexert yourself, yet you have to overload yourself. Time is for endurance 20 to 60 minutes, strength training 20 to 45-minute workout. You have to slow to medium tempo for each repetition. For cardiovascular endurance, we go for high intensity. Interval training is best. But for strength training, we have to go for slow and medium tempo. Type, we all know that for cardiovascular, walking, jogging, biking, anything which moves you, right? For strength, resistance training, weight dumbbells, barbells, anything that makes you strong or make yourself uh, heavy lifting kind of a thing, anything that gives you that feeling. So when we talk of 24 hours, we have to have 8 hours of sleep, 8 hours of your daily routine work. But in that work, you should incorporate few exercise snacks. Then go for general physical activities, household work, light physical activity, moderated to intense physical activity, aerobic exercises, and anaerobic exercises. But we must understand the other side of pyramid as well, that we must make the environment sustainable. We have to have physical education at school. We have to have spaces where we can be physically active. We can incorporate active commuting, and make sure we can avoid sedentarism, because Even if you do exercise 1 hour a day and rest of the time you're completely sedentary, you may get the lifestyle diseases that cannot be reversed. So WHO gives you the recommendation of 150, at least 150 to 300 minutes of moderate intensity aerobic physical activity. Or if you are going for vigorous intensity exercises, you have 75 to 150 minutes, right? And also, you have to have 2 days a week strength training. But remember, if you are going for more than 2000 minutes per week of exercise, it could be dangerous to your health. So, हमारे पुराने लोग बोल गए हैं कि अति हर चीज की बुरी होती है. The same applies here. You must motivate yourself to move, but you should not make it a obsessive compulsive disorder kind of a thing. So we have, if you want to be in exercise, physical medicine, and you have to recommend exercise, you have, what you are doing actually, you are doing facilitating a behavior change in someone else, whether it is whether he or she is a patient or a fitness enthusiast or a sports person or your medical student corner living in the hostel, not going out much. So you have to assess, advise, agree, assist, and arrange. This is a 5 A's model to facilitate behavior change. In this case, what we need to assess is we need to take an exercise history and the person's readiness to change. And we must assess what is going to benefit this person. And can we give social support? What social support one can have? Because in simple terms, sometimes our medical students, which is there, does not go for evening walks because he does not have anyone to walk with. So simple thing like that can also affect the physical activity. Yet we have to go for the CPET like thing. If we do not have PO2 max, then we can go for MET, indirect calorimetry, and those things also. And based on how the VO2 max is in a person, we can get what kind of problem the person is having, where is the functional capacity getting affected, and where is the limitation. And according to that, we have to go for the assessment, and therefore we need to plan accordingly, and our advice should have it in mind. So always provide a structured, individually tailored counseling message based on the patient's stage of change, and always give them a written thing. It's never going to help a person if you say that you need to work hard on your physical activity, improve your physical activity, because 99% think मैं तो चल रहा हूँ, जितना मुझसे होता है मैं करता हूँ. So you have to be very clear about what you are going to give. And I'm just putting towards that what are the stages: pre-contemplation, contemplation, preparation, action, and maintenance. Pre-contemplation is where the person is not active and is not bothered about that, whether he's ready. So effectively, he's not ready to be active. Whereas in contemplation, person is not active, but he thinks that he can do it. In preparation, the person starts doing it, And he said, like, yes, I can go ahead. In action, the person starts according to you. And in maintenance, you should say that those changes who are which a person has attained should be maintained. Otherwise, the person will get disheartened and will go into the contemplation or pre-contemplation stage. So you have to advise about, whenever you are advising, you need to think about the personalized risk, immediate and long-term benefits of changes. So you need to agree on the next stage, initiate shared decision making based on the patient's stage of changes. If a person is not agreeing on your given fitness protocol, give them advice to reduce sedentary behavior and help them. Help them in a way to give them options and choices and suggestions about how they can change their sedentary behavior. They can change their seating, they can change the location of their beds, they can move TV out of their bedroom, or many things, many such things. That decision must be taken by the person who is involved, because it's his lifestyle and you are just modulating it, not changing it. Assist in identifying the barrier to change and offer the problem solving. You have to correct all the misunderstanding around it, provide information and resources, provide social support. Last but not the least, provide with a written prescription based on what he or she has to do. Frequency, intensity, time, and type. All four components has to be there, and your prescription has to change accordingly. Therefore, you need to arrange for the referrals and the follow-ups. Otherwise, the same exercise will not make benefit, because the body get adapted to a particular level. So therefore, you have to have a progressive overload, specificity, and individuality in your things, right? So how can you overcome barrier? You have to address the time constraint. द सबसे बड़ा परेशानी है, मेरे पास समय ही नहीं है, समय ही नहीं मिलता, प्रॉब्लम्स बहुत है, घर में इतना काम है, ऑफिस में इतना काम है, there are so many deadlines to match. So encourage short and frequent sessions. Managing medical conditions, you have to tailor the exercises to the individual capabilities. You can start with easy things like just do some respiratory exercises or some movements at your joints. You have to enhance motivation, and you can use interviewing techniques. You can use their own lifestyle stories with their own problems, and you can ask them to suggest how and why they can include. Here comes the concept of exercise snack, and research shows that these exercise snacks performed throughout a day may be more beneficial than 1 hour stint at gym after sitting all the day. And exercise shots are very short bouts, anywhere between 30 seconds to 5 minutes, that don't require going to gym or any prep work. They are not just 2 minutes of leisurely walking break, but we must understand what we have to do is at least 1 to 5 minute workout where you can feel that your heart rate has changed. And you should try talking when you are doing that so that you know that you can hardly speak. So that means you are going for moderate to vigorous intensity of work, right? It can help in your weight management, sarcopenia, age-related sarcopenia, cardiovascular health, your stress and anxiety. You can sleep better, and metabolic changes may be taken care of. Okay, so last slide of my uh, is we must help the person reach to a purpose why he should be doing the physical activity and goal. We all have seen this advertisement, right? A old man who cannot even lift his kettlebell takes an inspiration, try to do it regularly and religiously to lift her grandchild to put the star on top of the Christmas tree. So if they all are willing to do something for their family, for themselves, you have to get that purpose and goal where that could be the best motivation. So we do have been for a we do need some competencies, and these competencies is to demonstrate knowledge of evidence that specific lifestyle changes can have positive effect on the patient's health and outcome, to use nationally recognized practice guidelines to assess patient in self-managing their health behaviors and lifestyle. The nationally and internationally recognized is very important because uh, what is locally recognized will help the patient best. Then you have to have a good collaboration with the person whom you are approaching and involve their family members to develop an evidence based, achievable, specific, and written action plan. So, there's something which is truth, but your perspective can make it look different. So, everything which here is an opinion, not a fact, and everything we see is a perspective, not a truth. So, therefore, try to understand the other person's perspective of their life because you are influencing my life of someone else, right? It's not just exercise. We must understand if you're putting, you must ask for diet, and based on that, we should go for it. So, with this, I stop and I'll here. Any questions? Anything? Any queries? Please feel free to share in the chat box so that we can answer. Thank you.
Thank you, madam, for this wonderful uh, talk on the exercise physiology. It was really wonderful to hear. There were many new things, even which the audience must have learned, which you have introduced as the exercise snacks. So, everybody is so fond of snacking. Let's now begin to snack on the exercise also. I also welcome Dr. Nayak on the platform here.
Thank you, madam. Uh, Umlata madam, it's a really very good lecture, and it was so nice to well neated concepts and well explained concepts, so that I believe everyone, as Manjinder madam mentioned, I believe all the viewer, they will be benefited with this lecture. Thank you very much. And
Thank you.
as it appears, not much questions are there. Not many questions we can see. Uh, so I believe people have accepted these. And I have a question, madam. I would like to. I know we are in the same institute still. I have a question on record that as you have suggested the snacks or the dietary changes, how would you like to what will be the span if as our wrist smartwatches suggest like 30 minutes gap or 1 hour gap or 2 hour gap, how you like, is there a reciprocal relationship that like if it is a 2 minutes bout it should be done frequently, or if it is a 5 minutes bout then it should be done less frequently? How you suggest?
No, it's not about the duration, but yes, you should not be sitting more than 3 years at one go, because research has shown that if you add complete 3 years of sedentary thing in a daytime, then it has a
Uh,
adverse effect.
I would like to interrupt. I think on the stream, YouTube is fixed on the competencies or on Madam's slides. It doesn't show what we are seeing here on our studio.
Okay, so what to
Madam,
do?
are you scrolling through the slides? Please stop the screen share.
Ma'am, I've stopped it. I've stopped it, ma'am. Is it still there?
Yes, I on the YouTube I do not see three of us. I see your slides.
Ma'am, I
Madam,
have already
madam,
already.
in my YouTube it is going on, madam.
It's going
Here
on.
I could
Okay,
see.
let's continue.
Yeah, it's continuing. It's continuing, madam.
Right, let's continue.
So I was answering the question Dr. Nayak has asked, that how often we should be doing the exercise snacking. It's like it depends on you and your schedules, but they said the research says that you should not be sitting more than 3 hours at one go. So anywhere between 3 hours is okay. And another thing which is very important is, do not go for less than 30 seconds. If you are going for less than 30 seconds, be very vigorous so that you can feel the change in your heart rate to an extent that you cannot speak. And it's
Yes,
very
that
good. And
that's a
it's
very
very good
important.
if you want to go for a walk, go for hum. Then you will feel that you're whether you're going for a brisk walk or not, because if you are singing and if you can sing properly, that you're very low intensity. If your humming is like words are not coming out but you're humming properly, then it is moderate intensity. So you can have this, or you can take one person along with you, discuss something which is very important to discuss. Come and discussing it when we are walking, and then you can understand that whether you are getting that exercise intensity or not.
Yeah,
So,
that's a very good indicator. Like the speech, as you mentioned that while talking, you feel the breathlessness that let you know, okay, I am doing good. That's really very good indicator for getting done the exercise level. And yeah, that's another point what you have mentioned. Like in case somebody is having some issues with the muscular pain, or say sometimes we feel like during these seasonal changes, we feel some type of muscular like stiffness, some with cold, and some are like variations. When the season changes come, that time we feel that muscle stiffness. How you suggest to handle that?
uh, that time your breathing exercises helps. If you are going for
Okay,
slow
okay,
breathing, that helps in getting that pain a little less, because slow deep breathing helps in the increasing the pain tolerance. So that helps. And if you think that you cannot move your body, move your breaths fast, so that you can increase your heart rate to an extent that it can come into the purview of your cardiorespiratory um, and endurance levels. So that even if simple things can help. Just get from your chair 2 times or 3 times, sit, or you can have a stool there, stand on the stool twice,
okay.
something of that sort. Even 30 seconds can help. And in that manner, you can accumulate those active minutes to 150 minutes in no point. दिमाग में जाएगा ही नहीं और आपके 150 मिनट्स हो जाएंगे.
So this means we are leaving no excuse for the people who don't want to exercise.
Yes, yes,
Because
And
need is very important. Non-exercising energy thermogenesis is very important.
Madam, I have one question. Recently, we have seen that young adults at the age of 40s, they are having cardiac issues, or even, they are succumbing to death while working out in the gym or something. So, how would we, because most of the people around would be in this age group, and they must be doing some kind of physical activity, but still, cardiac issues are there. And we have also seen that the non-alcoholic fatty liver is also growing in young adults. So how can we address to this issue with this exercise snacking or something? Like, what is your perspective about it?
Ma'am, the problem of this people going in gym, what they do is they do not take care of their electrolyte balance. They do not take care of their homeostasis as a whole, and they are like impress करना है, ego पे लेना है. So they are not going for the progressive overload. They overload themselves to an extent where their intrathoracic pressure changes to a level where it going to affect their depolarization, and that is the window where the arrhythmia can ensue. Another thing, you are taking a plain water, not taking care of the electrolytes, can lead to the potassium changes, and that again will hamper the problem in the conduction and where this can happen. So you have to have the and your body speaks up. So please try to listen to your body. If your body is saying like आज रहने देते हैं, so आज रहने दो. जरूरी नहीं है कि आपको किसी को दिखाना है. किसको दिखाना है यार? तुम रहोगे तब ना दिखाओगे. आज नहीं तो कल दिखा लेना. So that kind of thing, and it usually happens. Ki, not just anyone, even people, students, and the kids of our own family. आज तो मुझे ये करना ही है. उनको ये समझने की जरूरत है कि आज कहीं नहीं जाना. कल भी आएगा, वो भी आज ही होगा. So that kind of thing. So they have to take care of these things when they are doing it. So all the five uh, principles needs to be taken care of: individuality, specificity, progressive overload, homeostasis. those things has to be taken care of.
So it's a like being from the physiology perspective, physiology first should come.
Yes, sir. Yes, sir. The whole concept of this lifestyle medicine was very much there since ages. हमने हिपोक्रेटिस को भी देखा है कि सुना है कि दैट बॉडी योगा आल्सो सेज social changes, do's and don'ts of your life, breath training, physical training, meditation. If you go for Ayurveda, they have Dincharya, Ritucharya, Sitcharya, you know, all those things. So it is very much there. We are just putting names, a fancy name of his, lifestyle medicine now, but it is not new thing. It is very much there. If you look around and see how your दादीमा used to tell कि आज बैगन बना है तो साथ में मूंग की दाल बना लो, don't go for अरहर की दाल, don't put dahi, something of like that kind of thing. Or if you are going for the like if we are going for a walk, then we should not eat this. कल तुमको एग्जाम है तो रात में ये नहीं बनेगा, आज तुम्हारे लिए ये काम करना है तो तुमको ये नहीं करना है. So they have this lifestyle and everything was built up. So that is what I can add, and it is very much there. You just have to look for it.
I think that's all, and thank you very much, madam, for
Thank you.
enlightening
Thanks a
us.
lot.
It's really a good one, and we really enjoyed it a lot. And we are having an announcement.
Yes.
Yeah, our next webinar on this platform will be by Dr. Richa Thaman Ghe, Professor, Sri Guru Ramdas Medical College, Amritsar, Punjab. She will be delivering a lecture on positive psychology and connectedness for a healthy lifestyle. And the webinar, that's the fourth webinar in this series, will be on the 28th of September 2024, Saturday, 11 a.m. Thank you. Thank you, Manjinder Madam, for giving this opportunity, and hope people will enjoy it. And that's all I believe. So we should conclude it here, Madam.
Yes, sir. Thank you so much. Thank you. Thank all the participants who have joined here on a live session with us, and also those who will be joining on the link on asynchronously. So everybody will get the certificates if you submit the feedback by midnight. And it's important to submit your feedback by midnight, uh, because we would know that the purpose of the or the learning objectives of the webinar they have been met with, and also it will help us in improving for the upcoming webinars. So with that we come to an end. Thank you so much. See you
Thank you.
on 28th September, 11 a.m. with Dr. Richa on the social and the stress, which is related to the social aspects, social connectedness, and the psychology, which affects the lifestyle medicine. Uh, till then, signing off. Thank you so much.
Thank you.